Some toddlers have bow legs, but often the disorder fades away as they grow older. However, in a few incidents, the condition worsens. This is Serin Ankunda. By the time she was 2, her mother noticed she had bow legs. Serin is now 7 and continues to be afflicted with the condition. Her mother recently brought her to the Comprehensive Rehabilitation Services Uganda offices, KOSU.
Naje ntimbiza kugaruka nangwa nayereka ona bazira banje ngo tuvine ki nsonga mwena jenze nakura ikigure kimwe kigarikire kini cyanga cyagumza mcyaje cyabe kirema.
Her last born, who is now 15 months old, also has bow legs. She says she will wait until he's about 4 to see if he doesn't outgrow them. She fears the disorder in the family could be genetic.
The type of bowed legs that she has is a Blount's disease, and there are some associations, genetic factors that are usually associated to this kind, so you can find it running within the family.
But why do some people have Blount's disease?
We have what you call the growth plates, the place where the growth of the bones starts from, okay? And as the body is growing, these growth plates are supposed to grow uniformly. So on one side, you find that on one side, the growth is not as uniform as the opposite side. So when it's not as uniform on the opposite side, then one side is growing faster than the other. And so the part that is growing slower tends to become shorter, and then the part that is growing faster tends to become longer, and so causing the curve that we get to see. If it's happening on the inside of the knees, then it results in bowed legs. If it's happening on the outside of the knees, then it becomes the knock knees.
If it is not treated, the growth becomes uneven.
We've had scenarios where people come in with the knees at almost 90 degrees or even 100 degrees. They become short by default because you've taken away a significant amount of height from them. And then they have associated problems like pain, early joint arthritis, swelling of the knees, yeah, and very much distorted anatomy within the knees.
Dr. Muhumuza says there are no early signs of this affliction.
When they are babies, they are a bit chubby. But then when they reach the ages of about 2, they become lean and start to grow in height. Because when you have the accelerated growth in height, that is when you get to see the symptoms.
Rickets can also masquerade as Blount's disease, but the treatments are different.
For example, they have the swelling of the wrists, they have the swellings of the knees, they have the swelling of the head, and also in the chest, the bones. So all those different things, and these ones can, for the case of rickets, it can actually be seen even as early as 6 months.
The doctor says of the patients they attend to at KOSU Hospital, 14% have bow legs. But is this condition preventable?
No, not really.
For a patient like Serin, the doctors opted for surgery.
You get the normal bone and then you break it in the form of, you can either use what we call an orthopedic saw to cut it open, or we can drill holes to weaken it, and that will allow us to correct the deformity acutely. And then after that is done, then we have to stabilize it or keep it in place in the position that we actually want. And that is when we apply what is called an external fixator. We put the pins that come to the outside of the body. It's a much more forgiving kind of fixation because the chances of it being infected reduce quite significantly.
Serin will be in hospital for a few more days to get her physiotherapy started because she needs the treatment before her joints are ravaged by the disease. Doctors will continue to review her as they look at the x-rays to determine when is the right time to take off the external fixator. Josephine Karunji, NTV.